Oaks Elementary. My name is Lorelei Francis. I'm a physician assistant, and I'm here to tell you a little bit about what that means. Physician assistants are part of a medical team that work closely with doctors and nurses, but are not quite like either one. Our job is pretty similar to nurse practitioners, but the training's a little bit different. Physician assistants, or PAs, order tests like blood work or x-rays or MRIs, use the information we get from that to diagnose illness or injury. And then we come up with a treatment plan and prescribe medications or physical therapy or sometimes help with surgery for problems that need surgeries. PAs work in inpatient settings, meaning inside a hospital where people are sleeping and living. They also work in outpatient settings like doctor's offices, and can also work in urgent cares. You may have been treated by a PA at some point yourself. I work currently in the NICU at the Children's Hospital of Philadelphia. NICU means Neonatal Intensive Care Unit, and neonatal means babies, so it's really a unit for sick babies. Many of them born premature and just need help until they can grow bigger and stronger, or sometimes babies that are born with other problems. To get here, I went first I worked really hard in high school and then went to 4 years of college to get my bachelor's degree in science. I then took some time off because to apply to physician assistant school, you need experience with patients. So I took some time off and I worked as an aide in a hospital first for about a year, and then I applied and started physician assistant school or PA school. I went to a 2-year program. There's also 3-year programs. The first year that I was in school, I was in the classroom all day, every day, just learning from books and taking tests. And the second year I did clinical rotations, which is where you actually go and work 1 to 2 months in different settings to gain all the experience from all the different areas of medicine. This is really helpful because then when you finish PA school and you look for a job, you have some experience with what the jobs really look like and can maybe know where you want to work. I think one of the coolest things about being a PA is that you can switch what area of medicine you work in. So personally, I started working in adult orthopedic surgery. So I helped with people that had broken their bones or that needed new joints like hip or knee replacements. And I helped see them in the office and try to help them feel better. And then if they needed surgery, I also helped in the operating room, being what's called a first assist, where it's the surgeon doing the surgery, and then I would be with them helping them do the surgery. Now, my job in the NICU here at Children's Hospital of Philadelphia, I have anywhere from 8 to 16 babies that I'm taking care of, and I basically spend my time learning them really well. I study how fast their heart is beating, how fast they're breathing, what their blood pressure is looking like, how much they're eating, and how much they're peeing and pooping. I study all of these things, and then every day we come up with a plan for that day for how we're going to treat that baby. I work really closely here in this job. When I round every day, I work with a doctor, sometimes another PA like myself, or sometimes a nurse practitioner or NP, and then the baby's nurse. And then we also work with a pharmacist who is a professional on medications, a nutritionist who's a professional on diet and nutrition, food, helping babies grow. And then we also work with case managers and social workers who help manage the baby from other aspects. So we have a big team to try to take care of the baby in lots of different ways, not just something as simple as prescribing medication. This is an example of the kinds of beds that our babies often are sleeping in. This can give them heat to keep the babies warm. And then there's all sorts of hookups for oxygen and monitors to tell us their heart rate and their blood pressure and things like that. I think the skills and habits that are important to be a PA are being really detail-oriented. So thinking about every single detail of the information I'm learning and then the treatment plan I come up with. I think myself and most of the people I work with, we love to have a checklist, and then checking off the things on those lists is something that gives us enjoyment. So sort of task-oriented and detail-oriented. We have to be really good at communication because we have to speak with our patients if they're old enough to speak. If they're children or grown-ups who can tell you how they're feeling, you need to be able to hear and understand what they're telling you. My babies can't tell me, obviously, so I rely on their nurses and their grown-ups, their caregivers, to tell me what's going on with the baby, and I need to understand and take that information in when I'm forming a treatment plan. And then I also need to be good at communicating. So when a baby's here in the hospital, this is this family's most important thing going on. So to be able to tell them what's going on accurately and when something's changing is really important. So communication is a huge part of my job. Ongoing learning is really important for all PAs, both as a requirement and because it is a good thing to do in an ever-changing world of medicine. Every 2 years we have to prove what we are doing to continue learning. And then working at a place like CHOP, there's always new research going on, and you really have to be reading articles and staying on top of the latest information because everything changes so quickly with medicine. Before I go, I brought a couple little props to give you an idea of the kind of patients we take care of. So this is called a snuggly. When babies have to be in bed all the time, we know babies love to be held, but when they're too sick and are in bed, this simulates them being held. So their head would go right here, and their feet kind of get tucked into this little nook right here. To give you an example of how small some of our babies are, I have here a normal newborn size diaper, so about the size of my hand. And then the diaper that fits our teeniest, tiniest patients is this big, so little. So you can see how much smaller that is than the other diaper. Sometimes we use special lights to treat certain things in babies, but we don't want their eyes to get hurt. So here's a pair of teeny tiny little sunglasses to put on teeny tiny little babies and protect their eyes. That's all I've got for today. I hope if you're ever thinking about a career in medicine, you think about being a PA. It's a great career. And hopefully sometime soon we'll be back in school in real life, and then I could take questions as well. Take care. Study hard.